A new Wordle puzzle is online. Click on the link to play.
Listening to the following video may give you clues. Please like and share the videos.
US records first monkeypox case since virus ed in Europe. The CDC is currently monitoring 6 Americans who traveled on a plane with the British patient.
The disease is rare outside of Africa, but recently the virus has been spreading among humans. The virus, which normally infects monkeys, can jump from a monkey to a person.
Most often, monkeypox is found in Central and Western Africa. Vaccines are available against the disease.
In the meantime, the CDC recommends getting the vaccine for monkeypox. MICT is monitoring 6 Americans after they sat on a plane near a British patient.
The CDC is monitoring 6 Americans who were on a plane near a British patient who had the disease. The patients were seated within 3 rows of one another and the British patient was tested positive for the disease.
No one on the plane has any signs of the illness, but the CDC says the risk to the 6 people is low, but it is possible that more cases will develop. The virus is not naturally found in the United States and is often confined to Africa and Asia.
The outbreak of the disease in the United States is not the first time the disease has spread outside of Africa. There have been 12 cases of monkeypox outside West Africa.
Many of them were reported in men who had sex with other male travelers. Although the CDC is still assessing the situation, the UK cases have been linked to sexual transmission among gay and bisexual men.
CDC officials say the outbreak is comparable to the recent hepatitis outbreak. The infection is usually milder than smallpox.
However, 1 in every 100 cases of the disease is fatal. It is important to understand the risks of exposure to the virus to avoid the spread of the disease.
The vaccine for monkeypox, developed from the smallpox vaccine, is highly effective in combating the disease. The disease is also highly contagious and can spread through sexual contact.
The CDC is also monitoring about 200 individuals who traveled on an airplane near the patient who had monkeypox. The man in the out
had been living in Nigeria before traveling to the US this month.
He has been in a stable condition and is being monitored by the despite the risk. There is no need to worry about the general public.
CDC is working with counterparts in other countries to prevent the spread of monkeypox. CDC and international health officials are collaborating to stop the spread of monkeypox.
The disease is spread through contact with monkeypox sores and respiratory droplets from infected people in close contact. Monkeypox is a highly contagious viral illness which is spread via respiratory droplets.
Monkeypox is extremely dangerous for humans, but it can be prevented by identifying and contacting infected individuals. The disease has 2 main strains, the Congo Basin and West Africa.
Each carries different risks, but the West African strain appears to kill about 1 in 10 people. Its CDC is collaborating with counterparts in other countries to identify possible ways to contain outbreaks of monkeypox.
Smallpox vaccine is very effective in preventing the spread of the disease in humans, but the end of mass vaccination programs made people under the age of 40 or 50 unable to get the vaccine. In fact, the UK and US have previously reported cases of monkeypox.
An outbreak in the United States was traced to pet prairie dogs housed with small animals imported from Guinea. Disease is more likely to affect travelers than people living in endemic areas.
Those traveling to the affected areas of Nigeria should be aware of the symptoms and take the necessary precautions. Infected individuals should avoid close contact with infected animals for 2 weeks.
Patients who have been exposed to monkeypox must be monitored for 3 weeks. If they develop signs and symptoms, they should visit a healthcare provider for medical advice.
CDC is closely monitoring a number of cases of monkeypox in the US and other countries.
Some of these cases are the result of male-to-male sexual contact. The virus is spread by sexual contact, a method previously thought to be unrelated to the spread of monkeypox.
Despite the relatively rare nature of monkeypox, the CDC is working with counterparts in other countries to develop guidance on how to recognize a possible monkeypox case. The CDC is collaborating with the Maryland Department of Health to prevent the spread of monkeypox in Maryland.
This outbreak is the result of the strain of monkeypox that has been re-emerging in Nigeria since 2017. The CDC is working with its counterparts in other countries to prevent the spread of monkeypox.
The CDC is working closely with its counterparts to contain the disease. Vaccines are effective against monkeypox.
Vaccines have been shown to be effective against monkeypox, a subclinical disease that mainly affects small African animals. It shares a virus with smallpox, which was eradicated by a vaccine.
Vaccines for smallpox protect against monkeypox as well. In this study, 24 monkeys were divided into 4 groups.
Group 1 received 2 mV injections, Group 2 received 1 mV vaccine, and Group 3 was given Drivax. Group 4 did not receive any vaccines, and the immune responses were monitored before and after the monkeypox exposure.
Vaccines against monkeypox are recommended to those who are likely to have come in contact with a monkeypox-infected person. Monkeypox can be fatal, but vaccination can help minimize symptoms and prevent it in some cases.
Vaccines are effective against monkeypox and smallpox, but the CDC does not recommend routine vaccination in healthy individuals living in endemic or regions. Although the incidence of the disease is decreasing, many people still are at risk for the disease.
In 2003, a monkeypox outbreak occurred in the U.S., linked to prairie dogs that were exposed to small mammals imported from Ghana. However, the outbreak was not fatal in humans.
Monkeypox is spread by direct physical contact, and the virus can enter the body through cuts, abrasions, and the conjunctiva of the eye. First human cases of monkeypox were reported in the Democratic Republic of Congo.
Today, it is endemic in Central and Western Africa. It is usually contracted from pet prairie dogs, small mammals kept in captivity, or by exposure to an infected prairie dog.
While the disease is primarily an animal disease, there are still more than 100 human cases each year in the area. A vaccination is the best way to protect yourself against monkeypox.
The biggest human outbreaks of monkeypox have occurred in the DRC. A follow-up investigation has identified 511 cases and a higher proportion of secondary cases than in previous surveillance periods.
A study of these cases showed that the human-to-human transmission rate was between 3 and 30. The largest outbreak in the Democratic Republic of Congo occurred in 2003.
This outbreak was prolonged due to the end of smallpox vaccination in the country. The resulting civil war has made it difficult to confirm the extent of the virus spread.
Symptoms of monkeypox. Symptoms of monkeypox include fever, muscle aches, and swollen lymph nodes.
The skin rash usually begins on the face but can spread to other parts of the body. The rash begins as a flat red bump and turns into fluid-filled blisters.
In approximately 1 to 5 days after infection, a person can expect to have a rash. The rash usually begins on the face and then spreads to the extremities.
Although rare in humans, healthcare providers may suspect other illnesses if the rash is accompanied by fever or a fever. The primary difference between monkeypox and other types of pox is the presence of swollen lymph nodes.
A healthcare provider will examine a sample of tissue under a microscope to rule out other possible illnesses. They may also collect a sample of blood to check for antibodies against the monkeypox virus.
The symptoms of monkeypox are typically mild and resolve within 2 to 4 weeks. However, some people may experience severe symptoms requiring treatment.
In most cases, people who are affected with monkeypox will need to stay in a specialist hospital for a couple of weeks. However, if you're unsure about the diagnosis, you can report the symptoms to the nearest emergency room by calling 111 or filling out an online form.
Although the condition is not spread easily between humans, it is highly contagious. A person infected with monkeypox may have been exposed to the virus from an infected monkey, or indirectly through the meat of an infected animal.
In some cases, human-to-human transmission has also been suspected. But since it does not transmit well from person to person, the virus can easily get into the body through an infected person's saliva or vomit.
The symptoms of monkeypox are similar to those of smallpox, but the disease is milder. The symptoms include fever, muscle aches, and backaches, as well as swollen lymph nodes.
They typically last 7 to 14 days and begin on the face and progress to other parts of the body. In severe cases, the body can develop pustule lesions on the chest and hands.